Hello, everyone. In this presentation, we will be talking about the importance of medication safety, compliance, and polypharmacy. We will first start off with medication safety, which is the freedom from preventable harm with medication use. There are different uses for medication. The common ones are to treat diseases, to manage conditions, as well as to relieve any symptoms. This is a quote from the CDC, and it states that medicines are generally safe when used as prescribed or as directed on the label, but there are risks in taking any medicine. So, what are adverse drug effects? There are harms resulting from the use of medications, and this includes allergic reactions, side effects, over medication, which is the unnecessary or excessive use of medication, medication errors, and drug interactions. Did you know that each year in the US, adverse drug events account for over 1 million visits to hospital emergency departments, resulting from harm due to inappropriate medication use? So, how can we prevent adverse drug events? We can take our medication correctly. You could take your medication at the same time every day. Also, to take your pills whole, unless instructed to crush them. Can refill your medications before they run out. Many retail pharmacies will offer automatic refills on your medications so that you do not need to remember to fill it. The pharmacy will automatically fill it for you. So that is always an option at your local pharmacy. It is also good to know your medications, and this includes knowing the name and strength of your medications, to read and follow the prescription label, as well as to keep a list of all of your medications on you at all times, whether that be on a piece of paper or on your cell phone. You can always utilize the brown bag review, which refers to bringing all of your medications and supplements to all of your doctor's appointments. It is recommended to bring all of your medications to the doctor's appointments, and this includes all prescription medications, vitamins, any over-the-counter medications such as creams and topicals, as well as any liquids. And by ensuring that you have all of your medications with you, this can help the doctor check for any misunderstandings or if there are any medication errors that could be fixed. It is also good to keep your medication safe. So this would mean to keep away from any direct sunlight or in the sun. So it's recommended to keep your medications in a cool, dry place. So this can be like in your nightstand or in your kitchen. It is also good to keep it in the original amber bottle. So that is the orange prescription bottle that it's usually kept in, as well as keeping away from any children and pets. So I would not keep this anywhere where they would be able to grab it easily. We can also monitor ourselves. So this would be knowing all of our allergies, could including food and drug allergies, to report any side effects that you may feel from any medications, as well as telling your doctor or pharmacist if you're not able to afford your medications. And there may be drug discount programs such as GoodRx, as well as some manufacturers may have coupons that can be available to you. Next, we will be talking about the importance of taking drugs correctly, and this is also known as medication compliance. This is a quote from C. Everett Koop that states, "Drugs do not work in patients who do not take them." So why is it important for you to take your medications correctly? This can slow disease progression, decrease the risk of life-threatening complications, be less emergency room and hospital visits, and overall a better health outcome. So how can you take your medications correctly? You can set phone reminders to take your medications, such as an alarm on your phone. You should take your medications at the same time every day. Using a pill box or pill organizer to sort medications. You could also keep a calendar to write down when refills are due, such as circling them when you are running out, and to leave yourself notes to help you remember. And then did you know that among high blood pressure patients, 89,000 Premature deaths could have been prevented with appropriate medication treatment. Next, we'll be talking about using more than one drug for a single condition, and this is also known as polypharmacy. So, what causes polypharmacy? This can be due to a large amount of medications, medication underuse, inappropriate medications, so having medications that you may no longer need to be taking, as well as medication duplication. So that is having multiple medicines for one disease or condition that don't necessarily need to be taken anymore. So how can you prevent polypharmacy? So you should use the same pharmacy to pick up all of your medications. Try to only have one prescriber. If you do need to have multiple prescribers, it is good to let all your prescribers know your medications that you are taking. Let your doctor know about all of your non-prescription medications. So this would include any cough medicine, any pain medicine that's over the counter, any vitamins. We will let your doctor know. And then have reoccurrent medication reviews with your prescriber or pharmacist. So this is just to ensure that both the prescriber and the pharmacy are up to date on all your medications, as well as there any medication duplications that we can get rid of for you. So these are the resources that we used for this presentation. Again, thank you for listening. If you have any questions, feel free to message us. If not, thank you, and then have a nice day.